Very good evening, friends. Meeting again in the session of Materia Medica and meeting after a long time for this Materia Medica session. Today, I will going to share a very short remedy, in fact, considered to be organ, but a very deep acting remedy and very close to sepia. That is Murex Purpurea. It is a purple fish or it is a mollusk. This remedy is a wonderful remedy if you will understand the remedy. What has happened in my practice, in fact, it was in 1994-95, around 37-38 years of lady, she came to me in a depressed mood as she was having a prolapse of uterus with a very severe leukorrhea. And it has been told to her that she should get operated for hysterectomy, but she was also having a diabetes since 2-3 years. So she was in dual mind whether to go for operative or not, because she was in a little bit covered state what to do, and she was afraid of doing the operation, and that's why someone told my name and she came to me. When I took the history, she was quite a depressed mood, melancholic, she was sad, and she had having a frequent urination day and night with polyuria. Specifically, it used to get aggravated at night. She used to have frequent and profuse menses. So every 21 days, 20 to 21 days, she used to get the menses, and it used to remain for 5 to 6 days, and it was profuse, and she becomes absolutely weak. She, on her face, she was looking quite indifferent. So I was very close to the sepia, considering that she might be a sepia, because it was early in my practice. I would have not read all the remedies in depth at that time. So sepia was well known, and all story denotes the sepia, female remedy around 35-40, then the menorrhagia, metrorrhagia, or even indifference state, melancholia, sadness, all those things. I was considering that, but when I was going through the history, there was only one thing which was prominent. So I asked about the issue she is having, and she had the 4 children, 2 males and 2 females, and she had deliveries every 2 yearly, and she had all those issues, normal deliveries. But thereafter, she has developed this prolapse of uterus and laxity in the muscles. She has operated for tubectomy earlier. And then when asked about the physical relationship at the end of the case, she said that, doctor, I'm very much interested in keeping the relation. That's why I have operated, because already 4 issues were there. And I could not remain without sex. Generally, we used to have sex every day, except the menses days. This was rather different. A lady who was diabetic, who was indifferent, who was melancholic, but when I discussed regarding relationship, she got excited. It was interesting, and this is exactly not matching with the sepia. Sepia, there is an aversion to sex, absolutely. Indifference toward the sex, indifference to the opposite sex. That is there with sepia. This exactly opposite state was there in Murex. So I was considering the remedy sepia, but I missed that, and then I asked them to sit down for 10 minutes. I will work on your case, and then I will prescribe the remedy. So I went through the Allen's keynotes, then I went through the Borix Materia Medica, and it has been written very specifically regarding that both remedies are very close to each other, as if they are looking like a sister remedy. But only one thing, it is opposite in Murex, that in Murex there is excessive sexual excitability, whereas there is an exactly opposite state, reverse is there in sepia. There is absolute aversion to the sex. It was mentioned in Allen's keynotes, it was mentioned in Boris Matramedica, and that's why I have considered that better to go with Murex, and I have started with her on Murex. Murex, at that time, I had a 30 potency only. I have started with 30. I have given it 3-4 days, 30, continued with the by combination number 15 for her persistent bleeding. After 15 days, when she returned, she was quite happy. And then she told one more feature, Doctor, I forgot to tell you that whenever I used to have severe leukorrhea, my mood is good. But whenever it stops, my mood gets disturbed. And that I never told you earlier. That was interesting. But after your medicine, everything was fine. Leukorrhea stopped. My mood is good, and I'm feeling better. I have continued her on Murex. I have increased the potency after 2 months, 200, then 1 m, and even her prolapse uterus that has also recovered. Her muscle tone, which was lost, has again got the strength, and because of which uterus, which was coming out, again gone inside. So it was interesting that Murex is the remedy which is very, very close to the sepia, but exactly opposite at the sexual sphere. And that's what we have to understand the Murex. So it was interesting case for me. Let us go ahead with the Allen's keynotes first. We'll discuss certain features from the Allen's keynotes. So Murex Purpurea, mollusk. Dr. Petrov in 1848 proved this remedy. Muricidi, a person of melancholy temperament. The first sentence defines the melancholy temperament. Same is there with the sepia. So very close to sepia. Even lilium tig, it is very close to at the nymphomania. Lilium tig and this remedy having sexual excitability. Platina is also having sexual excitability. But mood here is absolutely melancholy. For the sufferings of during the climacteric. So this is one more remedy one should not pervert at the climacteric period, like lachesis, like sepia, like sulfur, like sanguinaria canadensis. Great depression of spirits. Great depression of spirit. Depression of spirit, they don't have energy, they don't have a life in their mm, behavior. They feel as if they have lost everything. That is the melancholic mood, the liberation of spirits, which is there. Sinking and algon sensation in stomach, again very close to the sepia. Very, very close to sepia. So it was interesting. See, all the features, it goes very close with sepia. Least contact of the parts causes violent sexual excitement. See, very, very, very important. Highlight that. That is the difference between the sepia and murex. Slightest touch, it stimulates the lady. Excessive sexual irritation driving to self-abuse is origeuron and ginkgum metallicum. That is that causes a troublesome. They are so excited that they does the harm to their parts. That type of excitability is there with the origeuron as well as in the ginkgum metallicum. Such type of excitability is not there with murex. Violent excitement in sexual organs and excessive desire for an embrace, exactly opposite, reverse of sepia. So this is very important. One must understand the difference between these two remedies. Otherwise, they are very close to each other. Both are fish remedy. Both are having similar characteristics, but here it differs from one another. Sore pain in uterus, a distinct sensation of womb. A distinct sensation. Generally, womb, no one feels that they are having uterus, womb. But here there is a feeling, the consciousness of the womb, which is there with this remedy. Helonius is another remedy. Lysine is another remedy, where they are conscious about their womb. That is very, very important. Bearing down sensation, as if internal organs would be pushed out, very again similar to the sepia, bearing down sensation. Must sit or cross the limbs to ameliorate the pressure. See what is given in bracket, but no sexual desire is sepia. This is in murex with sexual desire. In sepia, it is without sexual desire. Menses are irregular, early, they are profuse, they are protracted, large clots. So protracted means long lasting, menorrhagia. Large clots, very important, bleeding remedy. Leukorrhea aggravated by mental depression, happier when leukorrhea is worse. Underline again this. This is very important. Mental symptoms alternates with leukorrhea. Mental symptoms aggravates when leukorrhea stops. When mental symptoms, she feels happy when leukorrhea is worse. Exactly alternating symptom and important of the murex. So this remedy is a wonderful remedy to be, one must know. The action, duration of action is not mentioned in book, but my suggestion that this remedy is a deep acting remedy. It works for longer time, so should not be repeated too much. You can repeat for 3-4 days, wait for the results, and then again, if you need, you can go for high potency. The relationship, compare lilium tick and platina in nymphomania. That's what we have discussed. Sepia in bearing down sensation, but has no sexual erythema. This is very important feature of the sepia. Sepia and murex, comparison between sepia and murex. So we have learned a very simple, important remedy in our day-to-day practice when we miss the sepia in such types of cases. Because of the only one feature which is going against the sepia is the increased sexual excitability, where you can think about the murex in your practice. So that's a wonderful remedy. The one more feature which is not mentioned in Allen's, it is a very good remedy for diabetes with nocturnal polyuria, and there is excessive hunger. That is one important feature one must add in their books. So these are very close remedies, the sepia and murex. Only thing is that murex is not well proved as sepia is well proved remedy. And that's why we never have a good understanding about this remedy in Mater Medica. But still, these are the features with which you can approach and treat the patients with confidence. So that's all for today. Tomorrow we'll meet again with another remedy. Few things which I have to discuss with you. Most probably from 1st of June to 15th of June or 16th of June, there will be no classes. Then after 16th or 17th, we'll start it again. In between 15, 16 days, there will be a holiday, complete holiday. So keep it in your mind. In between, my suggestion to all of you is go through the old videos again, read those remedies again, so that it will be good revision to understand the many things. And when we read it again and again, then it becomes fixed or it gets impressed on your brain, and then it touches you whenever patient is talking. So that's the homework which you have to do. Till that period will continue as time permits, but definitely I'm trying my level best to continue with the lectures till that period. So thank you and good night. Any question, query?
Thank you very much, sir.
Okay, welcome, and we'll meet tomorrow evening. Good night.
Okay, good
Thank
night.
you, sir. Good night.